Thank you so much, Dr. Caldoun and Governor Whitmer. I can tell you it's been a great privilege for the MHA and our member hospitals and health systems throughout the great state of Michigan to collaborate with you and your entire administration from the inception of the COVID-19 pandemic here in the state of Michigan. And I can tell you without question that your decisive actions, your amazing leadership has unquestionably saved lives. Now, I will tell you that the Michigan Health and Hospital Association mission is to advance the health of individuals and communities, and I've never been more proud of that mission than I am today. And I've never been more proud of the amazing hospitals and health systems throughout our state who are truly on the front lines of this pandemic. Our association has been in constant daily contact with the amazing men and women who work in those hospitals and health systems. And it's from that unique perspective that I can tell you we are very concerned about the potential for a COVID surge at the same time as a flu surge here in the state of Michigan later this year. In that scenario, many of our hospitals could potentially fill to capacity. That is a scenario that we have seen earlier this year in a number of communities throughout the state of Michigan. It's something that we have the opportunity to avoid by taking strong action now. Looking back at the 2019-2020 flu season, we had 952 flu-related hospitalizations here in the state of Michigan, and as you heard, tragically, 6 pediatric deaths. Now, we can avoid that same scenario if we take the right actions today. But the bottom line is, this is deadly serious business. Everyone's speculating today about when we'll have an effective and widely available vaccine for COVID-19. When you talk about the flu, the reality is that tool is already in our toolbox today. We know that flu vaccines work. From the perspective of the MHA and our hospitals and health systems, we know that flu vaccines have been proven to reduce the risk of flu-related hospitalizations for both children and adults. And that's proven and borne out by a wide range of peer-reviewed literature in the medical field. The bottom line is the science is clearly with us. As a result, we're very proud today to announce that we are continuing to strengthen our relationship and our collaboration with the Michigan Department of Health and Human Services in the following ways as we head into the 2020-2021 flu season. First, all hospital and health system CEOs earlier today received a letter co-signed by myself and Dr. Caldoun urging all of our hospitals to use both existing and new innovative outreach modalities to offer the flu vaccine to their communities. That could include mobile clinics, emergency departments, outpatient facilities, and think about this, in the last several months we have seen a very large number of new COVID testing sites sprout up around the state, organized and funded by our member hospitals. Those are perfect opportunities, we believe, to also provide the flu vaccine to the public. Secondly, we're asking our hospitals to both mandate and provide flu vaccine to all healthcare personnel. Now, the vast majority of our members for a number of years have had mandatory flu vaccine policies in place for frontline caregivers. We certainly want that to continue, but we'd like to expand that to all employees of our hospitals and health systems because they could very easily come in contact with those frontline caregivers, not to mention families, friends, and others. Think about the fact that in Michigan, hospitals employ over 230,000 individuals. We have the opportunity as employers to lead by example in this way. And finally, we are urging our members to amplify the public messaging that you've just heard about, to use our powerful communication channels in all of the communities served by our hospitals and health systems to lift up the importance of flu vaccinations this fall. It's more important now than ever. So again, I'd like to thank Governor Whitmer, thank Dr. Caldoun. You can rest assured that the Michigan Health and Hospital Association and our membership stands ready to be your actively engaged partners as we continue to combat COVID and we combat the flu in the state of Michigan. We are committed to advancing the health of all Michiganders. Thank you very much.